There's definitely hope whether you have Graves' disease or Hoshi-toxicosis or obviously Hashimoto's. There's usually multiple triggers, but you do need to incorporate the basics. Some people will jump into the functional medicine testing, but if you're not eating a healthy diet, if you're not managing your stress, if you're not looking to work on sleep, I mean, those are definitely the priorities. Usually you have to go beyond diet and lifestyles. Functional medicine testing is great, but definitely incorporate the basics.
This is Doctor Talks.
Hello everyone, welcome back to another episode of Reversing Hashimoto's and Thyroid Disorder Summit. And I'm your show host, Dr. Anshul Gupta. I have a very special guest with me today because he's talking about a very special topic about Hoshi-toxicosis as well as hyperthyroidism and Graves' disease. A lot of people talk about Hashimoto's and hypothyroidism, but there are very few experts, who want to talk about hyperthyroidism. So Dr. Eric Osansky is one of those, who specializes into that. So I'm really excited about our topic today. But let me introduce him first before we move into the questions piece of it. So Dr. Eric Osansky is a chiropractor, clinical nutritionist, and a certified functional medicine practitioner who has over 20 years of experience in health and wellness industry and has been helping people with thyroid and autoimmune disorders since 2009. He is the author of the books Natural Treatment Solutions for Hyperthyroidism and Graves' Disease, Hashimoto's Triggers, and the Hyperthyroid Healing Diet, and is a host of the Save My Thyroid podcast. Dr. Osansky was personally diagnosed in 2008 with Graves' disease, and after taking a natural treatment approach, has been in remission since 2009. After seeing how well natural treatment methods help his condition, he began using these natural thyroid treatment protocols to help others with different kind of thyroid and autoimmune thyroid conditions, including hyperthyroidism, Graves' disease, hypothyroidism, and Hashimoto's disease. Dr. Osansky, welcome over here.
Thank you so much for having me, Dr. Gupta. Really looking forward to this conversation.
Absolutely. And I think, like you had a great story of having a personal disease of Graves' disease and overcoming it in natural ways. So I think why don't we kind of like to hear your story of how you were able to overcome it?
Sure. So this was back in 2008. I was intentionally dieting and detoxifying, trying to lose weight, and I was very successful, but was losing a lot of weight. And it took me some time to realize that that was related, at least partially related to hyperthyroidism. And the reason I knew is because one day I was walking around a retail store, a Sam's Club, and they had one of those automated blood pressure machines, and I took my blood pressure, which was normal, but my resting heart rate was high. It was 90 beats per minute, and was unusual for me. So I took my heart rate the next few days, and it was anywhere between 90 and 110 beats per minute. And so I went to a primary care doctor, got some blood testing done, thyroid testing specifically, and sure enough, was diagnosed with hyperthyroidism, and then eventually went to an endocrinologist, and then was diagnosed with Graves. And so up until that point, I didn't have experience with Graves. My background is a chiropractor, but when I took my continuing education credits, I took some functional medicine courses or functional medicine seminars that focused on endocrinology, and they spoke about thyroid conditions, both Graves and Hashimoto's, and natural approaches. And so I knew I was going to at least give the natural treatment approach a try. Didn't know if it would be successful. So I made dietary changes, did some testing, and took some supplements. And long story short, gradually my condition improved, my symptoms improved and went away, and the blood test eventually normalized, antibodies, the Graves' disease antibodies normalized, and then I decided to help others with thyroid and autoimmune thyroid conditions. And even though I wrote a book on Hashimoto's as well, I have, as you mentioned, two books on hyperthyroidism, and just because I personally dealt with hyperthyroidism, I see more people with hyperthyroidism and Graves than those with Hashimoto's just because of my story. And so, yeah, that's in a brief summary how I went about restoring my health.
Absolutely. And that is so fascinating. A lot of people are not given a hope that they can be in remission or are able to reverse their thyroid condition. So, people like you who are practitioners and have helped people to not only reverse their own condition, but others, that is a huge, huge achievement. So why don't we actually delve directly into like talk a little bit more about like what is Graves and or like also a little bit about Hashimoto-toxicosis, situations. So tell us a little bit about those situations so people are a little bit aware of that.
Sure. So with Graves, it's just like Hashimoto's. Both Graves and Hashimoto's thyroiditis are autoimmune conditions. So with Graves' disease, you have what's called thyroid stimulating immunoglobulins. Those are the antibodies associated with Graves. They're a type of TSH receptor antibody, and they bind to stimulate the TSH receptors of the thyroid, and that causes the thyroid gland to secrete excess amounts of thyroid hormone. And so on a blood test, you'll see elevated thyroid hormones, so T3, T4, and then TSH is a pituitary hormone, and TSH, it signals to the thyroid gland either to produce more thyroid hormone, or in the case of hyperthyroidism, since you have too much thyroid hormone, it'll do the opposite. Doesn't want your body, it doesn't want your thyroid to produce more thyroid hormone. So you'll see low TSH, depressed TSH. And so Graves, low or depressed TSH, elevated thyroid hormones, and then elevated thyroid stimulating immunoglobulins, which again are the antibodies for Graves. So Hashimoto's, we'll get into Hoshi-toxicosis in a minute, but Hashimoto's, we see the opposite as far as TSH. You usually have lower thyroid hormones. It might be within the range, but not within the optimal range. And then as a result, TSH is high. So you see TSH high in Hashimoto's, thyroid hormones low or on the lower side. And the antibodies associated with Hashimoto's, you got the thyroglobulin antibodies, and then you got peroxidase or TPO antibodies, which are actually also pretty common in those with Graves too. And some people have all three antibodies, the antibodies for both Hashimoto's and Graves. So what is Hoshi-toxicosis? Because I'm guessing that a lot of people watching this are not familiar with Hoshi-toxicosis. So Hoshi-toxicosis, some with Hashimoto's, a lot of people again experience the hypothyroidism because the thyroid is low. But when you get damage to the thyroid gland, it could also cause a rush of thyroid hormone into the bloodstream and can cause transient hyperthyroidism. And so if you did a blood test, they would actually show hyperthyroid markers. So again, you'd have elevated T3, T4, that depressed TSH. And so how do you know if it's Hashimoto-toxicosis or Graves' disease? And you know because the antibodies, if someone test, let's say all three antibodies, if they have hyperthyroidism and their TSI, those thyroid stimulating immunoglobulins are negative, but the thyroglobulin and or the TPO antibodies are positive, then that is a pretty good indication of Hoshi-toxicosis. I mean, it's not perfect because you could have false negative antibodies, but most of the time, if someone has Graves, they will have those TSI. I mean, another sign of Graves is a lot of people have thyroid disease. So if even without testing the antibodies, if someone has hyperthyroidism and they have eye pressure, eye swelling, eye bulging, then in all likelihood, it's Graves' disease. And then there's also something called the radioactive iodine uptake test that looks at the uptake of the thyroid's uptake of iodine. And in Graves, usually that's elevated. I can't say I love that test, but again, and most people don't need that. If they know that if the TSI is elevated, they do the TSI, then again, you know it's Graves. Like I said, if you have the symptoms of thyroid disease, I know in the presence of hyperthyroidism, then probably is Graves. But if those TSI, those thyroid stimulating immunoglobulins are negative, and the person's not experiencing any thyroid eye disease symptoms, and they have those other antibodies, one or both of those other antibodies. And again, with the hyperthyroidism, then that is most likely Hoshi-toxicosis. Does that make sense?
Absolutely. Yeah. Thank you so much for kind of clearing these things, because a lot of people with Hashimoto's disease have been told by their doctors they are hyperthyroid. And then, suddenly they don't know what is happening with them. Because if you go online and search, then obviously it was told that it is Hashimoto's is associated with hypothyroidism. So this makes absolute sense for those people that for some amount of time you might be into Hoshi-toxicosis, and the way to differentiate it is these antibodies. So thank you for kind of sharing that. But the interesting point that you brought up was that antibodies can be shared between Hashimoto's and Graves' disease. Both are autoimmune conditions. Yes, there is some difference in the antibodies, but there is also overlap between the TPO and the thyroglobulin, which can be positive in both. So essentially, can you say that the approach to lower the antibodies, is very similar in both Hashimoto's and Graves, or is it different?
Yeah, it is similar. I mean, the main difference between Graves and Hashimoto's, it's the symptomatic control. So with Graves, typically you'll take antithyroid medication or antithyroid herbs such as bugleweed, and then a lot of people with Hashimoto's will take thyroid hormone replacements. But again, we got to keep in mind that they're primarily immune system conditions, autoimmune conditions, and you're absolutely right. So regardless of whether someone has Graves or Hashimoto's, you're gonna the approach is gonna be the same. Again, the book that I have Hashimoto's triggers, I could have easily crossed out the Hashimoto's triggers and put Graves and like maybe change some of it. Like 80% of what's in that book will also help people with Graves as well. And same thing with a lot of the information that's in my hyperthyroid book. So that obviously symptom wise it's going to differ, but a lot of as far as finding, removing triggers, healing the gut, which we very well might talk about here, but again, yes. So to answer your question, there is definitely overlap when it comes to addressing that autoimmune component and lowering those thyroid antibodies.
So again, a very important point. I think most people, do not understand that there are two separate components of either Hashimoto's or Graves' disease. One is an autoimmune component, and one is the thyroid component, whether your thyroid is producing excessive hormone or less amount of hormone. And the conventional medicine is only taking care of that piece of the puzzle of addressing your thyroid hormones, but they're not doing anything with the autoimmune piece of it. Is that correct?
Yep, that is absolutely true.
And that's where, like through your approaches, that and obviously the functional medicine approaches, is that where we work on the root causes and address these autoimmune components so that we can lower the antibodies.
Yeah, exactly. Exactly. I mean, really with any autoimmune condition, I mean, there's going to be some differences, but whether it's Hashimoto's, Graves, or multiple sclerosis, rheumatoid arthritis. Again, all these are immune system conditions, so the approach is going to be the same. There might be a tendency to have different triggers, like some people with maybe rheumatoid arthritis more likely to have triggers that are not as common in other autoimmune conditions, and same thing with Graves and Hashimoto's. But yeah, there's different categories of triggers and yeah, it's yeah, like you said. I mean, just same thing. I mentioned my book, your book behind you, Reversing Hashimoto, same thing. You could like cross out the Hashimoto's, put Graves, and just similar because it's all about addressing that autoimmune component. But like you said, there is that thyroid component, and it is important to manage it because there are some people who don't want to manage it. They just want to focus on the immune system because they hear us talking about how it's immune system. But it's important. You don't want thyroid hormone to be too low if you have Hashimoto's. And same thing, if you have elevations in thyroid hormone, you definitely want to do things to address the hyperthyroidism.
Absolutely. So tell us like a little bit about how people can lower these antibodies, like what is your approach of dealing with these things?
Yeah, so there's what's called the triad of autoimmunity, also known as the three-legged stool of autoimmunity. And so with the triad, there's a genetic component, exposure to one or more environmental triggers, and that increase in intestinal permeability, which is the medical term for a leaky gut. So genetics, we can't do anything about. I mean, we could change the expression of genes, but we can't change our genes completely. So the good news is we can find and remove the triggers, and there usually are multiple triggers, and then we could do things to heal the gut. And there are different types of triggers. There's food, there's stress, there's chemicals, there's infections. People could have nutrient deficiencies. I mean, there's again a number of different, and there's different types within those categories. So like infections, there's bacterial infections, there's viral infections, there's stealth infections like Lyme disease, Bartonella, there's parasites. So it can get complex. Just I mean, it's not always easy to find or remove the triggers, but that's what we want to do. And sometimes we could accomplish just by going through a comprehensive health history. Other times we need to, and many times I find we need to do some type of functional medicine testing, whether it's looking at the adrenals, looking at the gut, doing a comprehensive stool panel, doing organic acids testing, or maybe doing a stealth infections panel, doing molds, like testing your home for molds, or doing a urinary mycotoxins test. Those are some of the tests. Again, I don't recommend these tests on everybody. It depends on the person. And then the gut, just trying to find out what is affecting the gut, what's causing the leaky gut. And not everybody who has a leaky gut has symptoms. It's so just I'm sure you experience where someone says, "Oh, my gut feels fine. I don't think there's any issues with my gut." And again, many times it might look okay even on a stool test. Like you might not see parasites or H. pylori, but even that doesn't completely rule out a leaky gut. So yeah, I incorporate like the 5R protocol, try to remove the factors that can cause a leaky gut, whether it's something like gluten, so dietary changes, even stress could affect permeability of the gut. So trying to reduce your perception of the stressors. And again, infections, if you do have a gut infection, obviously trying to address the gut infection and then replace with digestive enzymes, stomach acid, commonly low in people, dietary fiber, reinoculate with pre and probiotics, repair the gut and rebalance the parasympathetic nervous system. So yeah, really just finding, removing the triggers, healing the gut. Again, make it sound easy, but like I said, it's very, as you know, it could, in some people, could be complex.
And the other thing which I've seen is that a lot of people are looking for that just one particular root cause. And that's where they are very focused on changing their diet a lot of times, but then they don't do anything beyond it. And a lot of times they tell that, okay, well, my antibodies or symptoms are not getting better. From my experience, I've seen that generally people will have more than one root cause, between two or three root causes playing a role together. Is that what your experience has been with too?
Yeah, definitely. I mean, even in my book, my most recent book, The Hyperthyroid Healing Diet, I still have an entire section that is beyond the hyperthyroid healing diet, that goes beyond just cleaning up your diet, because you're absolutely right. I find that eating a whole foods anti-inflammatory diet very important when it comes to healing, but it's usually only a piece of the puzzle. I mean, everybody's different. There are certainly some people that might just eliminate gluten, and then maybe that's the only trigger. But most of the time, it goes beyond that. They need to not only change their diet, but do a good job of managing their stress. And again, it's very common that functional medicine testing will show one or more other triggers. So yeah, diet's important, but I definitely agree that you usually have to do other things besides just cleaning up your diet.
So now, as we're talking about the topic of the diet, and obviously, with your recent book, so obviously there's a lot of confusion about the diet because there is so many different diets out in the market. Whether it's a AIP diet or doing a carnivore diet or a ketogenic diet. So, like, do you have any affiliation or like a recommendation for any particular diet, or again, it is depends on the person to person?
I mean, it does depend on the person. I mean, for example, in my book, The Hyperthyroid Healing Diet, I talk about three different diets. So it's not just like one diet fitting everybody. And even those three diets aren't, I mean, like you said, everybody's different. I mean, you mentioned carnivore, which I can't say I have my patients follow a carnivore, but for some people, it could be very effective in helping with autoimmunity. I usually have people follow, I do have people eat plant-based food, so it's not typically carnivore, but so yeah, AIP I think's a great diet. It is pretty restrictive, but for Graves, Hashimoto's, but also some people aren't ready to follow an AIP. Like mentally, they might be better off following just a regular paleo diet or maybe a modified paleo diet. So, the challenge again, everybody is different. So some people might be fine eating nightshades. Other people might not be fine eating nightshades. Same thing with some other foods. I think what we all would agree, definitely myself and you, and then probably everyone else participating in this, and that we whole healthy foods and avoid the refined foods, avoid the sugars, avoid the unhealthy oils, avoid the gluten, the common allergens, gluten while healing, dairy. I mean, again, can someone with autoimmunity reintroduce gluten and dairy later on? Again, there's controversy. A lot of people would say no, avoid gluten forever. Some would say even avoid dairy forever. But at least while healing, I usually recommend take a break from the gluten, take a break from the dairy, take a break from the corn, and try to avoid the unhealthy oils and stick with olive oil, avocado oil, coconut oil, avoid the refined foods and sugars. And so yeah, there's not a single diet that fits everyone perfectly, but I do put people on an elimination type diet and an AIP diet. That's essentially what it is. It's a type of elimination diet, just eliminating certain foods. But like I said, if someone's not mentally ready to follow an AIP diet, or if they're a vegan or vegetarian, it would be very difficult for them to follow AIP diet. So maybe we'll have them be more flexible, making sure they get enough protein and just see how they progress.
Absolutely. I think that's very, again, a balanced approach towards the diet, because I think extremes of the diet, can always be difficult for people to follow, and sometimes it can backfire. So I'm very glad that, you have a balanced approach, plus also very customized approach to each and every patient can be different. So now from the diet, why don't we talk about a little bit about chemicals and toxins? Because, that's again a very important topic. A lot of people get exposed to different chemicals and toxins. So what kind of toxins do you see typically playing a role, and as a trigger, especially for Graves and Hashimoto's disease?
Yeah, a big one are the xenoestrogens, the endocrine disruptors we have in our environments, and that's in the research as well. So they could directly affect thyroid, but they could also affect the immune system and potentially be a factor when it comes to autoimmune conditions such as Graves and Hashimoto's. So a big one, which more and more people are getting better about, but still there's a lot of people that drink out of plastic water bottles. And I mean, just I think overall, you want to minimize exposure to plastic. And I mean, I'm definitely not perfect. I try to avoid the plastic water bottles as much as I can. And I mean, if you're going on vacation or something like that, I understand every now and then it's not going to be a big deal. But if you're buying plastic water bottles by the case, then that might be something you want to change because again, it's not just me and other functional medicine practitioners saying this. It is in the research how it can negatively affect the thyroid gland and also potentially negatively affect the immune system. And then, I mean, so there's the endocrine disruptors, the xenoestrogens, and and again, it's not just I mentioned plastic water bottles, but there are other sources of plastic, even thermal paper receipts. So whenever you go to like a grocery store and you get the receipt, and again, this is in the research. So you touch the receipt and you get the bisphenol A going through your bloodstream, the BPA. And some would say, speak of BPA, some will with the water bottles. Now you see the BPA-free water bottles, but they have other, that they have other xenoestrogens, so BPS, BPF, BPF. Yeah. So anyway, and those have been shown to be just as bad and maybe even worse than BPA. So yeah, I would say even the BPA-free bottles, I would try to stay away from. I would say stainless steel, glass, and heavy metals. So heavy metals, mercury is a big one. There's still, unfortunately, a lot of people have mercury amalgams in their teeth. So just potentially seeing a biological dentist who will remove the mercury amalgams, taking the appropriate precautions, because if you go to a regular dentist, they won't take those precautions. They might not even want to remove them. A lot of times they'll say they've been in there 30, 40 years, just leave them in there. And again, it's not always a trigger. I definitely work with people who don't remove them and still get into remission, but I still would make it a goal, even if someone gets into remission, for an overall health perspective. But yeah, mercury can also affect the thyroid, also affect the immune system. And then there's other other heavy metals like aluminum. Nothing in the research that shows that it triggers Graves or Hashimoto's, but it is an immune stimulator. I mean, that's why it's used as an adjuvant in certain vaccines. And you could definitely take steps to avoid the aluminum by making sure you're not using aluminum pots and cans, not eating regularly out of canned foods, not using aluminum deodorants, for example. And and there's so many other toxins. I mean, again, not all of them are tied to autoimmunity, but still just the flame retardants. I believe there are some studies showing that that could affect immune system and potentially cause an autoimmune disorder, or at least be a contributing factor. Maybe in some cases, not like we said, there's usually multiple triggers, so it's hard to know. Is it the flame retardants? Is it, is it the xenoestrogens combined with eating gluten and all these other things, or the glyphosate? So the glyphosate also, before getting to glyphosate, so flame retardants found in like clothing, furniture. So like the mattress you sleep in, that you sleep on, like we have a natural mattress, and I mean, if someone just got a mattress like recently or even a year or two ago, I'm not saying replace your mattress, but again, just something to keep in mind, because most people are going to spend 6 to 8 hours in their bedroom, hopefully at least 6 hours, hopefully, honestly, at least 7, 8 hours sleeping. And if not, definitely want to work on that. But yeah, so just the fumes. So that could be a factor. I mentioned glyphosate, which is the active ingredient in the herbicide Roundup. And again, I haven't seen anything showing that glyphosate specifically triggers Graves or Hashimoto's, but there definitely is evidence that it disrupts the gut microbiome, which is important. Most of the immune system cells, like 70, 80% of the immune system cells, are in the gut. So if you have an unhealthy gut, you're going to have an unhealthy immune system. So eating organic will at least help to minimize glyphosate. You're not going to eliminate it completely. There are some foods now that'll like say glyphosate free. And I mean, if you're eating whole healthy foods, again, you're going to minimize your exposure to glyphosate. And that's what it's all about. No matter what you do, you're not going to completely eliminate your exposure to environmental toxins. So you just want to do as much as you can, especially in your own home. Again, there might be other speakers who I'm sure who spoke about this, but natural cleaners and cosmetics. Again, you don't have to go crazy and change all your furniture, like I mentioned, flame retardants, but still just be aware of that. And definitely cleaners, cosmetics, the food you eat, the water you drink, purify your water. Consider a shower filter or a whole house filter, because it's not just the water you drink, but the water you bathe in. And then, yeah, just air purifier. So once you step out your home, you don't have a whole lot of control. So you definitely want to do as much as you can in your own home.
I think it's a process. I think people just need to be aware of it, that, there are multiple exposures that, they might be going through in the daily life, and being aware of it and being cognizant in the future of making better decisions. Because as you said, it will be too overwhelming to completely turn your life upside down, and can be very expensive too, if you
Yeah.
just want to remove these exposures. But like, at least be cognizant about it, reduce your exposure today, and then obviously in the next couple of years, you can really be clean, right?
Yeah. Well, I mean, and I will say this, I mean, it's not that expensive. I mean, like to change, like to get a water filter, even like a shower filter, like, yeah, if you get a whole house filter, then that could add up. But getting a shower filter for $80, a water filter, yeah, maybe it costs a couple of $100. But again, if you're buying water by the case, that's going to add up too. And again, natural cleaners, cosmetics, again, I mean, it does add up, but it's not like you have to spend thousands of dollars to make some changes. But I think just like with the food, some people might not be ready to jump into AIP diet. Again, like I don't want people to get overwhelmed and say I have to make all these changes. I would say, start with your water at the very least. If you're not drinking purified water, if you're drinking tap water, again, water out of plastic bottles, maybe start with that. And then yeah, maybe you could like start with some of the more commonly used cosmetics and cleaners. Like if you spray around the house, maybe you just replace that one spray that might cost like $5 to get something natural, or you can make your own even with like baking soda, apple cider vinegar. But yeah, so you definitely don't want to get overwhelmed. So I don't think it should take most people like years to make all these changes, but I mean certainly doable within a few months for most of the major, things that we use on our everyday basis. So.
Absolutely. Again, that's great. So we spoke about the diet, we spoke about the toxins. What else do you have, like, that can help people to lower the antibodies and also improve their graves?
So, I mean, stress is a big factor. So we spoke about food, we spoke about environmental toxins, and stress is also something we usually can't completely get rid of because we're always going to have stressors. And so just doing things to improve our stress handling skills is important. And it's also important to keep in mind it's not just emotional stressors. So one thing I mentioned earlier when I was dealing with Graves, before being diagnosed, I was dieting and detoxifying, but I was also overtraining. I was overdoing it. I was putting a lot of stress on my adrenals, not just with the emotional stressors, but over exercising. So a lot of people are doing high intensity exercise, which I mean, there's definitely some health benefits of high intensity interval training, but some people are overdoing it. Some people running marathons and triathlons. And again, I'm not saying there aren't health benefits of that, but you want to listen to your body. And so it's a combination of the emotional stressors, the physical stressors, the traumas, even past traumas from many years ago could be a factor. And sometimes we might need to speak with a counselor or work with another expert that deals with trauma. But from just a basic stress management perspective, I recommend just getting in the routine of stress management, starting out with 5 minutes per day, just because, again, it would be great if we could do 20, 30 minutes or more per day. And maybe eventually you will, but you want to get in that routine of doing something every single day, just like eating healthy. You don't want to just eat healthy 3 days a week. Okay, I'm just Monday, Wednesday, and Friday. I'm going to eat healthy so same thing with stress management. You want to every single day, but even if it's 5 minutes and just getting in the routine. And once you're in the routine, maybe still some days you just do 5 minutes, but then other days you'll gradually increase to 10, 15, 20 minutes per day. So yeah, stress is huge and sleep is also huge. That kind of ties into this because stress affects adrenals negatively and sleep will affect adrenals negatively. And again, sleep could be a work in progress. Some people neglect their sleep intentionally, but then others want to get sleep. They just have problems. And again, just there could be so many different factors when it comes to sleep issues. But yeah, getting proper sleep and then making sure you're doing things to appropriately manage your stress.
Absolutely. I think those are all great tips, and each and every person can easily implement them. That's the beauty about things that you're talking about, that, each and every person, if they're a little bit regimented and if they want to make some changes, then these can be huge game changer for all of these people.
Yeah, I mean, yeah, you're right. I mean, it's not 5 minutes per day. Just about everybody could do 5 minutes per day. So yeah, it's the stress. I'll say that when I work with, again, I see a lot of Graves patients, and I mean, with Hashimoto's too, stress is a factor, but with Graves, it seems like 90% of the time when I consult with someone will say that I think stress is my trigger. It's very, very common. So they'll know even before speaking with me. And so again, I mean, some stress management sometimes might not be enough. Again, I like testing the adrenals, whether it's a saliva test or doing a dried urine test like the Dutch test and seeing what the adrenals look like, looking at the circadian rhythm of cortisol. And some people do need supplements to help support adrenals, or at least can benefit. Maybe they don't need it, but to help speed up the process. But if all you do is take supplements and you're not managing your stress, you're really not going to get optimal results.
Absolutely. I think that's very important. A lot of people undermine the impact of stress, on Graves' disease or Hashimoto. So I'm glad that, you stress the importance of it. So I think we covered so many different topics and we are coming to the end of our discussion today. Any parting words you have for people or anything we have not yet covered?
Well, I mean, there's a lot of things we didn't cover, but again, we could go on easily, I'm sure, another hour or two. But I mean, just I would say that I mean, there's definitely hope whether you have Graves' disease or Hoshi-toxicosis or obviously Hashimoto's. I mean, there's, as we discussed, there's usually multiple triggers, but you do need to incorporate the basics. So, I mean, some people will jump into the functional medicine testing, but if you're not eating a healthy diet, if you're not managing your stress, if you're not looking to work on sleep, I mean, those are definitely the priorities. We were just saying in the beginning that it's not usually you have to go beyond diet and lifestyles. So again, functional medicine testing is great, but definitely incorporate the basics. And then, yeah, we'll consider obviously working with someone, whether it's Dr. Gupta here or me or someone else. It's really hard to, I mean, it's even when working with a practitioner, autoimmunity is challenging, but definitely it's more challenging doing it on your own and lowering the antibodies. Again, it does take some time, but definitely can be done.
Absolutely. I think those were great words from you. So tell people where they can find you, the great, amazing work that you have been doing, where they can know more about all this information.
Yeah, so I do have a podcast. It's called Save My Thyroid. And you can either visit savemythyroid.com and click on podcast, or just go to your favorite podcast platform and type in Save My Thyroid. And most of the episodes will benefit those with both hyperthyroidism and Hashimoto's. There is a little bit of an emphasis on hyperthyroidism just because there's not a lot of information out there with hyperthyroidism. And then my books. Again, you mentioned the 3 books, thyroid related books. So you can just search my name, Eric Osansky, on Amazon to find the 3 books. And then naturalendocrinesolutions.com is actually my first website that has mostly articles and blog posts related to thyroid health and thyroid autoimmunity. And yeah, those are I also have a YouTube channel as well, so you could search for my name on YouTube. But those would be the main places people could find me.
Absolutely. And you'll have all of these linked in the description. So please go check it out. A lot of great information. Thank you so much for coming over here today. I know we just scratched the surface today, but at least giving hope to people that they can get their graves better. So thank you so much for coming.
Yeah, thank you so much, Dr. Gupta. It was great having this conversation.
Absolutely. All right, guys, this is it for today. Thank you so much. Bye-bye.
Thank you for tuning in to Dr. Talks. We hope today's episode has enlightened and inspired you on your path to optimal health. Each day is a new opportunity to make choices that empower your well-being. For more insights and strategies, subscribe to our podcast and visit our website, www.drtalks.com. Stay connected, stay healthy, and join us next time on Dr. Talks, real talks from real doctors on the issues that matter to you most.